Speaking in broad strokes, I think we can say that Rusfertide has really kind of nullified the need for phlebotomy, right? I think that that's kind of the simplest way to think about that. And we know that phlebotomy is really a part of every patient with polycythemia vera's journey with their disease, especially early in the disease, and oftentimes throughout the course of the disease, patients are needing phlebotomy in order to maintain that hematocrit less than 45%, which we typically recommend for all patients, sometimes a bit lower depending on some patient-specific factors. So I think the easiest thing to suggest is this could be a part of everyone's journey with polycythemia vera. I think it's easiest to see in those patients that are requiring frequent phlebotomy or don't tolerate phlebotomy, or are kind of challenged by the frequent kind of visits to the office, doctor's office, and getting labs checked that comes with phlebotomy. So I think this is something that can free those patients up or allow them to gain hematocrit control without the intolerable phlebotomies they may have been otherwise requiring. I think you could think about in low-risk patients that where we don't always use cytoreductive therapy, this is something that could be easily used to control hematocrit in conjunction with antiplatelet therapy, and really reduce the amount of times patients have to come in to the doctor's office from that standpoint. I think in high-risk patients who may be on cytoreductive therapy, if they're continuing to need phlebotomies, this is an option, or this allows them to optimally dose those cytoreductive agents so they don't have to be on high doses, which often come with some tolerability issues. And then I think it's something that we need to continue to think about how this impacts patients' disease-related symptoms, right? So we did see in the Verify study that the Rusfertide met its kind of third and fourth key secondary endpoints, which was an improvement in fatigue and improvement in disease-related symptoms. And so if this is something that we can continue to bear out, I think it may even have broader applicability, because we know that one of our unmet needs is even when we're controlling blood counts in these patients, they suffer with fatigue and brain fog and lack of ability to kind of concentrate on things or stay in jobs and kind of be as productive as they used to be. And so if this is something that can improve those types of symptoms, then even in the setting of controlled hematocrit, maybe this is something that we can leverage as well. And so, I think it certainly fits in a lot of different potential buckets, and fits a lot of different patients, but it may be different for different patients, where exactly it fits into that treatment paradigm.